Okay, now we're going to talk about what is included in a psychoeducational assessment. And the first thing I want to share with you is this acronym called RIOT. And we as assessors use this acronym to help us remember to include certain components in our assessment. RIOT stands for record review, interview, observation, and test. And when we're doing these things, we are really looking to build a comprehensive picture of the child and learn about them from different perspectives. And also, we want to see them ourselves and learn about them from our own perspective as assessors. And so, RIOT is something that helps us to make sure that we are doing that. And I'm going to describe each of these concepts and what they might look like for your child in further slides and also on different parts of the series. But before we get into that, I want to talk to you a little bit about this term standardization. So what does standardize mean? That's a question I get asked a lot from parents and families, guardians, and even teachers. And what standardized means is that tests that have been given to many students across the United States and norms have been established. So what does that mean? That means that these kids all took the same tests in the same way, and we got them grouped by age. And now we can look at how kids at a certain age or grade performed on a test. And we use the way that these kids are grouped to help us to understand where most kids are falling, where some kids are struggling, and where some kids are doing well. And in a second, I'm going to show you something called a bell curve that's going to give you a visual of what that looks like. But generally speaking, when we're thinking about kids and any people actually that we take data on, we are typically seeing something called a bell curve, meaning that we have a limited amount of people falling on the fringes. So that's either very low or very high, and most people falling in this middle range, which is why we call it the average range, because that's where most people are falling. And so again, in a second, I'll show you a bell curve that's going to give you a better visual of what that looks like. But for now, understand that when we give a standardized assessment, that test has been established and has been used with multiple kids across the country. And now we have a sampling of how those kids did. And we're going to use that information to compare the student we're currently assessing. And that's going to help us to understand if the current student we're assessing, if they're performing the way we expect, like, most of the kids fell in that bell curve. Are they performing lower or are they performing higher? And again, the visual of the bell curve is going to help you. Another thing about standardized tests is these tests have to be given a certain way, okay? And that is so important because when these tests were established, in other words, when that norming happened, when all the kids across the United States that were part of the samples, what we call it, when those kids were brought in for testing, the testing was given a certain way. And so this is part of standardization. There's a specific set of directions and things that the assessor has to say. And also, we as assessors can't give hints or help a student out because we are measuring how this child is doing. And if we give hints or help a student out, we run the risk of not having a true indication of their skills. And then also, we break standardization and we use the tool in a way it wasn't meant to be used. The other part of standardization is that certain materials have to be used. So we buy test kits. These test kits come with different components, and we have to use those components for the test. So we can't substitute or give a test if we're missing some of the components of that measure. And so you'll see us with test kits that have different parts, and you'll see us interacting with children using those different parts of the test kit. And they are all meant to be used in that manner. And that's part of standardization. We're using the test in the way it's meant to be used. We're using the materials in the way they're meant to be used. We're even using the test record where the child answers or where we write notes in the way it was meant to be used. And once we've assessed the student, what we're going to do is we're going to score how they did. And these tests have manuals that are going to help us to score how a child did. And so we're going to do some adding and possibly some other math in order to get scores, and then we're going to compare them to what the manual says. And that manual is going to tell us, okay, if this child is this age and they got this score, here's how they performed. Again, helping us to understand, were they within what's expected? Were they higher? Were they lower? Because remember, the purpose of special education is to look at educational performance. Okay, and so we're always coming back to that educational performance. And a note on that is that educational performance is not just academic, it can be many things, but some of our tests are going to focus more on either academics or intelligence, sometimes processing. And then we have another set of tests that will help us to learn more about kids' social, emotional, and behavioral skills. And here's a link called Psychological Evaluations, What Every Principal Should Know. Although it says what every principal should know, it is a good tool that's helpful for anyone who wants to learn a little more about psych evals. And in particular, it has a section on standardization. So here's that bell curve I was talking about. And before I go into it, I just want to point out that there is a link here that says click here for English and Spanish bell curve. And it's really cool. If you click there, you'll get to this bell curve and some explanation, as well as the same bell curve in Spanish. So hopefully that's a helpful resource for you. When we're looking at this bell curve, again, remember, this is representing people who've been assessed or looked at in a certain way, and we're plotting them to see how they performed, okay? And so you see down here, we have this bar, and in the bar, you can see that there's this name that says standard scores, and we have numbers, okay? And so when we look at standard scores, we're looking at scores that are either below what's expected or within the expected, or what we call average range, or above or well above. And so remember when I said that it's not typical that we have kids on the fringes. Here's something that's at the edge, and here's another part that's at the edge. And so we don't really have a lot of kids or people on these fringes. That doesn't really happen because most people are falling here within this average range, okay? And so when we're looking at scores, when we test kids, we're all the time, we're looking for kids who are not really falling in this average range. For the most part, we're looking for kids who are falling below this range. And even for kids who are falling above, but for the kids who are falling above, that's telling us that they have a strength in a certain area. And sometimes maybe even our gifted kids would be identified here, but I don't assess for gifted personally, so I can't speak to exactly how that might look. What's really important for you to know about this is that when our kids start falling in these areas, this means that they're significantly impacted. And even this area here, although it's not so far away from this average area, it is an area that means that there's a struggle. And when we start getting into this area, we know that there's significant struggle, and we know that the child's going to have a lot of difficulty with whatever area they're performing in this range in. So what do I mean by that? I mean that if you have a kid and you give them a math assessment and you're looking at math calculation and they're coming out with a standard score between 55 and 70, for example, 60, we know that math calculation is a very difficult area for them. And we know that it's going to be a struggle. Conversely, if that same student performed at a 120 for reading comprehension, we know that that's an area of strength. And so we're also always looking at these scores to help us to determine if students are having challenges across all areas or if it's just in certain areas. And that's also going to help us in our assessment. And again, in building an IEP, or also in determining how we can use strengths to support weaknesses. So I am happy to help anyone who has more questions about this. This is just a general overview, but if you can start to learn about the bell curve, it will be helpful. One more thing I'll say is percentile ranks are also very helpful. Essentially, what a percentile rank is where a person falls in 100 people. And so if you have a child who's at the 5th percentile rank, we know that they're number 5 from the bottom. So 1 being the lowest and 100 being the highest. If they're falling at a percentile rank of 5, we know that they're struggling very much in comparison to peers, because 5 is going to be somewhere between 2 and 16. So it's about here. And look, it's here in the below average range, okay? Conversely, if we have a student who's performing at the 98th percentile, in other words, here, we know that that student has some strengths, because in 100 kids, that kid is going to be second from the top, meaning there's only going to be 2 kids that are stronger than them. And so this is another way to look at performance. And I personally prefer percentile ranks because I think it's easier to say if there's 100 people in the sample, where is my child falling? And so that's something you may want to do when you're looking at assessment reports. Something to note is that you want percentile ranks to be high for skills you want to see. For example, math, reading, writing. You want percentile ranks to be high. But when we're looking at behavioral problems or social challenges, we want percentile ranks to be in the average range. We don't want them high, and we don't really want them too low either. So for example, we have a test called the BASC, Behavior Assessment System for Children. It's a rating scale, and that test will plot out how children are rated in different areas. One of those areas is called externalizing problems. And a part of externalizing problems is conduct problems, which is rule breaking behavior. We do not want conduct problems to have a percentile rank over here, because if we see that, that means that this child engages in more rule breaking behavior than their expected range, than their peers who are within the average range, okay? And so when you're looking at undesired skills or undesired behaviors, you want that percentile rank to be in the average range or a little lower. You do not want it to be high, because if it's an undesired behavior or an undesired skill and it's high, it means that they're using that undesired behavior or undesired skill more than their peers. And that's for percentile ranks. And so I hope this helped, and I'm going to come with another video in a sec. See you soon.